This introduction will explore the supports offered by Connecticut Birth to Three, their research based approach, what supports look like in practice, and how to assist children and families through the referral process. Connecticut Birth to Three, also known as Part C, Early Intervention, is positioned at the Connecticut Office of Early Childhood, OEC. Let's learn more about early intervention.
Early intervention under Part C of the Individuals with Disabilities Education Act, or IDEA, offers supports and services for children from birth to age 3 with developmental delays or disabilities and their families.
Connecticut Birth to Three is part of the Individuals with Disabilities Education Act, IDEA, Part C. This law ensures children birth to 3 have access to developmental supports and related supports and services as needed. Let's learn more about early intervention in the state of Connecticut from Dr. Ann Milanese, developmental pediatrician at Connecticut Children's and medical advisor for Connecticut's Birth to Three system.
We started in Connecticut in 1987 after the establishment in 1986 of the Individuals with Disabilities Education Act, or IDEA. Over the years, the program has surely grown and changed, influenced both by the needs and desires of families and by the emergence of a robust research-based literature on how best to support the development of young children. The basic premise of early intervention is that developmental growth is grounded in the relationship between young children and their loving caregivers. The comfort and familiarity of the real day-to-day routines of their lives or natural environment serves as the very best backdrop for growth and progress. We focus on each family's daily activities to develop an intervention plan specific to the child's strengths and needs. We empower the caregivers to partner with our experts as a team to set priorities for the intervention plan, to maximize learning opportunities for the child, and to support progress and success. Early childhood experts from Connecticut have been leaders in the national conversation about early intervention. Our Birth to Three program is truly a jewel in Connecticut's crown.
Children in Connecticut are eligible to participate in Connecticut's Birth to Three program if they are under 3 years old and have a significant developmental delay based on a standardized test or have a diagnosis of a medical condition that's likely to result in a developmental delay. Let's hear from a Connecticut parent named Lisa about her first experience with Connecticut Birth to Three.
Hi, my name is Lisa, and I'm a parent of 4 children. 2 of my children have participated in Birth to Three and had really incredible experiences. My oldest came out of the hospital after a traumatic birth and needed to participate in the Birth to Three system. We had a wonderful woman come to our house and help me learn how to mother this child that was developing a little bit differently than I thought he would. Uh, he had a quick turnaround in Birth to Three and no longer needed services before he was 3 even. We went on to have our second child, and then our third and fourth came together as twins. And one of my twins was developing a little bit differently than the other one. I had some concerns. I brought it to my pediatrician, and then I thought back to my Birth to Three experience with my first and knew that I needed support, the same type of support I needed with my oldest.
You might be wondering, what are the steps involved in getting a child connected to Birth to Three supports? Anyone can make a referral. In fact, families are the #1 referral source. Many families are referred to Birth to Three by their child's primary healthcare provider, but referrals don't necessarily need to come from a medical provider. Other referral sources include early learning providers, extended family, and others. Regardless of how the initial referral was made, an eligibility evaluation will not proceed unless the parent consents. A referral should be made when a child isn't reaching developmental milestones, if an established condition exists, when a parent expresses concern, or when a pediatric healthcare professional has concerns. There are no costs to the family because those referred to Birth to Three have services entirely covered by state and federal funds, Medicaid, and commercial insurance. After a referral is made and consent is given, the next step is receiving an evaluation. During an evaluation, a team of 2 professionals meet with the parent, caregiver, and child where the family lives or where the family is most comfortable. including a preferred location in their community. These are called natural environments and can include anywhere a child lives, plays, or spends time, such as childcare, a library, or park. Early intervention professionals, in partnership with families, evaluate the child's strengths and needs.
Parents and caregivers play an important role during the early intervention process as they are the team members with the most knowledge of their child's interests and activities and their family's daily routines.
Together, the team, including the family, will evaluate all areas of development, regardless of the initial reason for the referral. These areas of development include cognitive skills, such as problem solving, memory, and learning; communication skills, such as expressing needs and wants, following directions, gesturing, and talking; social or emotional behaviors, such as developing relationships, expressing emotions, and learning about self and others; physical development, such as seeing, hearing, movements, and health; adaptive skills, such as self-help or daily living skills. If a child is 16 months or older, they will also be screened for autism with parent consent. Let's hear more from Lisa about her experience with Milo's evaluation and diagnosis.
At 2 years old, Milo, my youngest son, was evaluated for birth to 3. He was found eligible. We did an MCHAT and determined that there was probably a pretty good reason to uh, call in an evaluation for autism. In June of that year, when Milo was 2 years, 4 months old, Milo was diagnosed with autism. And that day changed our lives in not a negative way. It made us much more aware of our parenting.
The third step in the process is a team meeting to discuss the results of the eligibility evaluation and form a plan. Families are part of this from the very beginning and throughout the whole process. If a child is eligible and the family would like to participate in the program, the team will create an Individualized Service Plan, or IFSP. An IFSP is a written document that helps identify the child's strengths and needs within daily routines and activities for specific outcome development. It outlines the recommended supports and services for the child and family and details when, where, and how the program will deliver these supports and services. Once the IFSP is in place, supports and services offered by the team may include speech therapy. Speech therapy supports and services assess and identify speech and language-related delays or disabilities and how this impacts a child's ability to communicate their wants and needs. Additional considerations would include how these challenges impact a child's ability to participate in their daily routines. Occupational therapy. Occupational therapy supports a child's ability to participate in many daily self-care routines, including diaper changing, dressing, mealtime, bath time, etc. Areas of consideration might include fine and gross motor skills, as well as senses, including vision needed to interact and participate in their family's routines. Physical therapy. Physical therapy supports a child's large motor development, such as sitting, walking, or climbing. It also focuses on helping families support their child in actively exploring their environment and participating in family routines. Developmental therapy. Developmental therapy focuses on promoting caregiver and child interactions and supports caregivers in learning new strategies to enhance development and participation in everyday activities and routines. Let's learn more about the changes within the early intervention approach and the role of families during services provided within natural environments.
Historically, early intervention was provided using a traditional approach with a medical or clinical focus on fixing skills the child had not yet mastered. During the intervention session, the parent was often a passive observer, relying on the provider to influence the child's development.
You want to do another one?
There is now a shift in early intervention service provision.
Oh, yeah, Marlo.
Based on current research, we know that we can have the most positive impact on the child's development if we use more routines-based interventions that support active family engagement.
Okay. I'm going to drink my juice too.
Interventions that are embedded in natural family routines offer more frequent practice of new skills where learning most naturally occurs.
You did it!
As this video highlights, how early intervention services are provided has evolved over the years to align with current research and best practices. Now, according to the American Academy of Pediatrics, evidence-based application for best practice provision of EI services includes creating frequent opportunities that allow for learning in the natural environment rather than in simulated treatment situations, and utilizing methods of coaching as a supportive and collaborative approach for interacting with families, medical homes, and EI programs providing services to infants and toddlers. Let's learn more about each of these approaches. Routines-based approaches in natural environments are research-based. Evidence is clear that children learn best when supports and services are provided as components of everyday activities, such as family mealtime, playtime, bathing, bedtime, laundry, and visiting family and friends. Strategies are developed with the family that help them address their goals for their child during these everyday activities. Let's listen to what Robin Huff-Nagel, a speech and language pathologist, has to say about providing family supports and services in the child's natural environment.
And our role is a coaching role. And instead of bringing in our toy bag and directing the services, we come into the home and we take the time to get to know that family, get to know that family's routines, get to know what's in their toy box, get to know what's happening during each of those routines, what that little person's doing and what that little person's not doing. What would the family like for that little person to be doing during that routine, and encouraging their participation. And I believe that my therapy is far more effective today than it was 25 years ago, because I am in the child's home. I am using the child's foods, utensils, toys, clothes, their couch cushions, their bike, whatever. We're using those things, and we're teaching the parents all about what they need to know in order to help that little person grow.
As Robin highlights, natural environments have been proven to promote a child's development, learning, and participation in family and community life, expand the child's opportunities to experience and practice new skills beyond the time the therapist is present, and instill confidence in the parents' abilities to meet their child's needs and support needed skills at home and in the community. Services are often provided using family-centered coaching. Family-centered coaching includes partnering with families to provide supports within routines to promote the child's active participation.
So when I'm working with a family and using coaching, I want to, engage with that family, interact with them, and understand what's happening during their routines throughout the day.
Is that yummy, yummy, yummy?
So that we can identify the routine and the times that they can best help their little person accomplish the goals, develop their skills, and be able to do optimally what we would like for them to do.
One more time.
I want to give them the tools and the education, the knowledge of what are the next steps that they're going to need in order to help their little one continue to do that same activity the next day or the next day.
Apples, eating apples, just like you.
Let's hear from Lisa again about her experience getting established with services and in setting and working on goals with her interventionists and family.
Or what does this mean for the future for our son? What does it mean for our future for our other children? And how do we support them the best way that we could? And through that kind of sadness came this idea that I had that autism meant we kind of got to skip lines at Disney World. And not that you really skip lines, but somehow in my head, the autism was going to help us at Disney World. So I had this crazy idea that I brought to my husband, and I said, I think we need to go to Disney World. And he said, that's a big order. And I said, absolutely, but we have our team that we can kind of make outcomes, and we can make our family outcome be getting to Disney and having it be successful. So I brought it to our service coordinator, and I said, I'd like to go to Disney World. And she said, I would too. So for our family, what we needed to do was we needed to figure out how to participate in a really overstimulating area like Disney. As a family, we needed to learn how to wait in lines. We needed to learn how to go through a toy store and not bring something home. We needed to be able to learn how to sit at a table as a family in a restaurant. That's something that we hadn't done much. We brought it to our service coordinator and we said we'd like to go to Disney. And in that, we needed support in figuring out how to parent a child with autism at Disney World, where it was going to make it fun for the whole family. Our service coordinator helped us learn how to wait in lines. She helped us learn how to come through a toy store without getting anything and also without melting down. We learned if there was a meltdown, what to do. We learned how to sit at a restaurant and have breakfast and eventually dinner, because that was something we were going to have to do on vacation. And it sounded like these big things to get to this big end goal. And it helped us so much more than just that week in Disney. We were able to go out to dinner as a family. We were able to go to overstimulating museums or carnivals as a family and it be successful. And those are all things that we learned with our Birth to 3 team. I still go back to those strategies that we learned in Birth to 3 to help parent even today, because the impact was so much so. It was such a positive outcome for our family going to Disney World or going to a carnival. Anything seemed accessible now, and it all came back to our experience with Birth to 3 and the success that we had with our family outcomes and getting this incredible experience.
These supports often look different than families might expect. Let's look at another example of this evidence-based service intervention. In this example, you will see 18-month-old Ricardo. As you watch, ask yourself, what skills do you see being demonstrated with the support of Ricardo's siblings? What do you think the therapist is doing during this visit, or how has she worked with the family to help them set up this interaction?
P Q R S T U V Y Z. Now I know my ABCs. Next time, won't you sing with me? Your turn.
You may have noted that they are working on turn-taking, torticollis, communicating, social interactions, listening, and other skills. Since this is happening during the regular activities of the family, some may have looked at this and thought that no intervention was happening, but that is definitely not the case. You may be wondering, where is the interventionist in this video? Let's hear more from Robin about an interventionist role using this research-based approach.
When it comes to coaching, I oftentimes describe it as I'm going to be on the sidelines helping you know what are the next steps to take. And we're going to look at that together and identify the situation and go, what could we do next? What is he enjoying? What is he delighting in?
Son, it's time to clean up. You ready?
The provider focuses on supporting every family where they are. This means that each family is looked at individually. Family priorities and uniqueness are celebrated and built upon. This is the starting point for the early interventionist.
Oh, sweetie.
Let's look at what planning these visits looks like. In this example, the interventionist is working with a young girl named Hannah and Hannah's mom. Together, they create a plan not only for what activity they will focus on during this visit, but also for their next visit.
So last time I was here, we did story time, and you were having some questions about how to get her to cooperate and share in that story time, and we came up with some strategies. So how did it go?
It went well sometimes, and other times it was a little bit frustrating. So if I try to look through the book and read with her, she gets really kind of controlling over it. She wants to hold it and turn the pages, doesn't really want me to read to her or talk to her about the pages.
Did you try anything different?
I kind of let her just be mad, and I turned and read to Penny a little bit more, and we kind of had a nice activity and let her be a little bit mad, and then she did kind of calm down and join in again after a minute, I think, when maybe she realized
Yeah,
that was gonna work.
Yeah, that was really nice that you
Now that
had
I'm
her.
thinking about that, yeah.
Yeah, you had a great idea. You had mentioned maybe getting the same book. Were you able to do that?
Oh no, I forgot to do that. I think that would be a great thing to do this next, especially with the holidays coming up. We could find a couple copies of the same book either at the library or at a store.
Today, you had talked about wanting to do something with cooking because you were having trouble getting a meal done because she wants
She
your
wants to be like
attention.
this.
Yes.
If there was a way we could troubleshoot how to cook together or have her do something while I am cooking, that would be really helpful.
Okay, that sounds like a good idea. And that still works for you today?
Yeah, let's
All right,
do it.
let's do it. Did you have? How does she usually get up in the chair?
Usually I put her there. You want me to help you?
Oh, but she looks like she's doing a good job.
All right.
Oh, look at
All right,
that.
so don't put you there next time, right?
What is happening?
Typically when I'm cooking, I'm trying to be chopping things or standing at the stove or getting things out of the fridge, and she's like right on my leg.
Now, what strategies have you tried? I know picking her up and cooking
Holding
with
her
your hand
and
is
trying her with my
one.
hand. Yeah, I have tried giving her some toys or like asking her to go get a toy, which doesn't always go up. But if I pick something and put it out here or on the floor even, we had talked about that sensory bin.
Yep.
So I was able to put those on the floor at times and they'll play and keep themselves busy for a little bit, which is good. I think the hard thing sometimes, of course she's not here at the moment, but is if Penny wants to participate as well, or if there's something she can't do that I need to do because it's hot or there's a knife or something like that.
Good opportunity to work on that turn taking.
Oh.
So if it's okay with you, I'm gonna see if maybe I can have a turn.
Sure.
See how that
would
goes.
be great. Yeah, please do.
Thanks, Mama.
You're welcome, honey.
Diana, it's my turn. My turn to start.
Oh.
Thank you.
Nice letting Gina have a turn. Wow.
Okay, your turn.
Thanks.
You're welcome.
Aw. It's gonna be my turn.
I was just gonna say, you should
Right?
have a turn too.
Okay.
You
All right,
read
so
my mind. Good job.
It's gonna be my turn.
Mommy's turn.
Okay, you're waiting.
So I'm gonna, just so that it's very concrete, I'm gonna count how many stirs.
Oh, okay.
One,
Look.
I want to
two,
add this one now.
three.
Tina had 3
Okay.
turns. All right, Penny's turn.
Penny's turn. Do 3 stirs.
Good.
Okay, now it's Hannah's turn.
Hannah's turn. 3
But
mixes.
after, now I'm going to add the food coloring.
Okay, let's do 3 turns.
It looks like a rainbow. Go ahead, Hannah. You want to
I'll
have a
open
turn?
this when she's done.
3 turns. That's a really good idea.
So is this working?
Better
Better?
than, yes, the
Okay.
waiting usually does for sure. Good job.
Good
You handed it
job.
over. Wow. All right, we like that counting.
That was a great job. So you think that's something you can,
We could definitely do it.
what kinds of things do you think you might be able to do?
So I think giving her things that are close by so she feels like she's participating.
Wait, this is my turn.
Safe, like
Yeah.
easy things. So maybe it's going to be helpful for the meal or maybe not. But just
Yeah.
like something that I
No.
have ready for
See
her.
this?
So this week, the counting for turns, including her
The meal.
in some meal prep that's safe to do so, and then just having that backup plan of another.
Extra activity or sensory activity. Maybe just play out.
Yeah, that's there. You go.
All right, if it comes. And then next week, I don't remember if we set a time yet that we're meeting.
We didn't.
Okay,
What
but I
I-
was really hoping it could be like taking a walk,
Okay.
if possible.
When would be a good time to do that?
Probably before nap.
One additional service that is included as part of Connecticut's Birth to 3 Early Intervention Program is called a service coordination. The service coordinator is a Birth to 3 team member and assists the family with identifying, accessing, and organizing the supports they and their child need. For example, a family may disclose during a visit that they are struggling to have enough food, pay for high heating bills during the winter, or looking for assistance with finding a parenting group in order to connect with other families. In these instances, the service coordinator can support access to information regarding the resources which are available, as well as facilitate connections for the family. As you can see, a variety of family-centered supports are available, and we hope these examples provide a greater sense of what participation in services could look and feel like. Next, you may be wondering, how do I make a referral? There are 3 options for making a referral. Individuals may contact 211 Child Development by calling 1-800-505-7000 or visiting 211ct.org. Complete the referral form online provided at the birth23.org website. This form may also be printed and faxed to 1-860-571-6853. Speak with their child's pediatrician for additional information and assistance in making a referral. If your child is found ineligible, there are several resources you may find helpful. A child found not eligible for birth to 3 may be re-referred after a period of 1 month. In the meantime, you are encouraged to use developmental monitoring and related activities, such as those available through Help Me Grow. Help Me Grow supports include printable growth charts, screening brochures, and more. Additionally, families can receive information on various topics related to their child's development, such as managing difficult behaviors, toilet training, sleep issues, promoting language development, and typical developmental milestone information. To learn more, visit ctoec.org. HMG also uses a tool called the Ages and Stages Questionnaire, or ASQ, to screen development. This is available through the Sparkler app at ctoec.org/Sparkler, via mail, as well as online at the 211 Child Development website at cdi.211ct.org. Additionally, for children who are within 45 days of turning 3 years old, there may be other program offerings. Let's hear one final time from Lisa about the impact Connecticut Birth to 3 had on her family.
The big takeaway from Birth to 3 in our experience is the strategies that I learned in Birth to 3 with our first experience and our second experience helped shape me into the mother I am today. It still helps guide me through parenting. It still helps me work through my children's big and small emotions. And when things go wrong, I kind of always revert back to my Birth to 3 knowledge.
We hope this introduction to Connecticut Birth to 3's research-based system has been helpful, and that hearing from the professional and families in this video today has helped provide useful information about the identification, evaluation, and services and supports provided by Birth to 3. We appreciate your assistance in helping identify children's needs for developmental supports and services when there is a concern regarding a child's development or behavior. The first 3 years are the most rapid period of development in a child's life, and together, we can ensure that families have the supports needed to help their child learn and grow.